Hey everyone! Today, let's dive into the fascinating history of public health in the United States and how it has shaped our world. In the late 19th and early 20th centuries, public health was all about fighting infectious diseases like cholera, tuberculosis, and diarrhea. With improved sanitation, housing regulations, and innovations like pasteurized milk, death rates plummeted. For example, in New York City alone, death rates dropped by a whopping 60% between 1875 and 1925. Life expectancy soared from just 36 years in 1880 to 53 years by 1920. But as we moved into the 1920s and beyond, the landscape changed. Chronic diseases like cancer and heart disease began to take center stage, and the old methods just weren't cutting it anymore. Public health visionaries like Winslow in 1926 and Surgeon General Perrin in the 1930s and 40s saw the need to integrate medical services with public health to tackle these new challenges. Perrin even pushed for national health insurance and more funding, although his legacy is marred by unethical experiments like the Tuskegee and Guatemala syphilis studies. In the 1940s, President Truman tried to push through a national health program that included grants for public health and medical care, but it faced stiff opposition and ultimately failed. By the 1950s, public health advocates had scaled back their ambitions, focusing only on local health department funding, which also fell short. So what happened next? Federal funding for public health departments declined, while the National Institutes of Health received more money for chronic disease research, widening the gap between healthcare and public health. Medicare and Medicaid came into play, but they bypassed public health departments, and centralized health planning efforts in the 1970s failed. As a result, life expectancy in the U.S. stagnated after the 1950s, falling behind other developed nations. The COVID-19 pandemic further exposed weaknesses in our public health system, ironically stemming from a communicable disease, the area where public health had originally thrived. So what's the path forward? We need to learn from history and recognize the importance of robust public health initiatives. The key is more investment in public health, not less. Let's not forget, the successes of the past came from bold, innovative actions. It's time to bring that spirit back to tackle today's health challenges. If you found this video insightful, don't forget to hit the like button and subscribe for more health news updates. Thanks for watching.